Oh, fantastic. Great. My name is Winnie Lubembe. I am a TV presenter as well as a host. That is as far as health and lifestyle is concerned. I'll be moderating this X Space today, and I am not alone. I will be co-moderating together with Benjamin Zulu, who is around. So I'll just give him a chance as well to say hello and talk a little bit about how important this conversation is to all of us listening.
Good evening, and I hope you can hear me. My name is John Kimura. I'm a clinical psychologist practicing at HealthX Africa, a telemedicine company or organization. And I'm happy to be part of this great conversation on mental health issues, because that's a place I spend most of the time dealing with people who are to help support people address workplace, family, and school related issues. So I'm happy to be part of this conversation. Thank you.
Yes, thank you so much, Wanja, and thank you all listeners. My name is Irene Kashindi. I'm an advocate of the High Court of Kenya. I practice in Munyao, Mudhama and Kashindi Advocates, and I head our employment and labor practice team. I'm also fellow of the Chartered Institute of Arbitrators, that is UK and Kenya, and I practice labor law mostly, both from a local, regional, and international perspective. Thank you.
Good evening, everyone. As you've heard, my name is Crystal Serena Vulavu. I am a medical doctor by training, the head of wellness at Minet Kenya, and licensed designated health practitioner, which means I practice in occupational health and safety, including workplace health. And I am happy to be here this evening. Thank you.
Good evening, everyone. My name is Betty Kaguya. I'm a formerly imprisoned woman. I work with Clean Start Africa, which is an organization that deals with women, girls, and children who have been impacted by the criminal justice system. What I do basically is I ensure that the imprisoned women, we take them through mental wellness, and also we follow up post-imprisonment just to make sure they are in the right mental state post-imprisonment for reintegration into the society. Thank you.
All right, thank you for the opportunity to be part of this insightful discussion. Okay, I go by James Nyabera. I'm a mental health advocate and founder of A Man Must Cry mental health movement. It's a community-based mental health movement that champions for men's emotional well-being and mental health support. I'm also someone with the lived experience of childhood trauma and high-functioning depression. For a long time, I wore a mask showing strength on the outside while silently battling pain inside. That's why today I use my journey to push for safe spaces within families, workplaces, and schools where people can be real about their mental health struggles without fear of shame and judgment. And thank you so much for the opportunity.
James, I think I'm just going to begin with you. Before we even understand, first of all, the impact of mental health, and not just an individual, but also as a family, in organizations, in schools as well, can we just get to hear a little bit about your journey in terms of when did you realize that you were struggling mentally, and what exactly did that look like?
All right, that's a good one. I remember it was in the year 2017. That's the time I realized I'm going through a mental health torture or a burden that I used to carry, but I didn't get to know the name to give it until I was advised with one of my friends to look for a therapy so that I can also get to understand what kind of heavy emotions that I'm going through. So by just expressing that or embracing that kind of right channel, going to see the therapist, that's when we engage deeper into my story. And that's when I was in a position to know what I was really struggling with. And by that time is when I was diagnosed with childhood trauma and high functioning depression. And until from that day, I was helped to, start embracing healthy coping mechanism that has helped me till the moment just to be that active boy, and also trying to use my story with all that I went through also to help others navigate their mental health journey, even by giving birth to my initiative known as a Man Must Cry mental health movement, just specifically dealing with young boys and men's emotional well-being and mental health support. And it is something that we are currently embracing now by just making sure like we create safe spaces for young boys and men to find a support system moving forward, and a place whereby they can just feel free to open, talk about their stories and struggle with mental health, and also get the necessary support that they want when it's come to, let me say, the right channels to get the mental health support moving forward.
Thank you. Thank you very much, James. And John, allow me to rope you in there where James says he didn't know, first of all, what it was and how to even what name to give it until he got support. So I just want to know to hear from you, first of all, how are we doing as a country? And is this a common thing that we see that a lot of people could be struggling mentally and don't even know, and probably just speak a little bit on how it manifests itself and maybe signs to look out for?
And thank
Yes,
you so
please.
much. And it's great to hear James share his story. And of course, there are many people who are going through the same case or the same kind of scenarios like James. And when you think about it, especially men, it's normally not very easy for them to be able to disclose what they are going through. In Kenya, of course, we note that mental health among especially men is on the rise. And it's not because that they have maybe bigger challenges than maybe the ladies, but it's because they do not have the right spaces that they can be able to speak about their issues. Now, for you to be able to identify that man, and I'm happy that I'm saying this because as we go on with the next few months, we are headed to November. It's very famous for most men because we grow our beards and we remind each other that it's time to keep our mustache. And the idea is because we want to speak about our mental health situation. Now, my experience working with men, and I've done this over a couple of years, is that it's not easy to have them speak about their issues. As a country, if you look at it, is that the suicide rates in the country are on the increase, and it's also in alignment with the current rates of mental health situation. And again, even also noting that we have less support in terms of even the professionals who are able to support mental health activities in Kenya, or rather care in Kenya. And thinking about it globally, you'll find like we talk about around 1.4 million maybe psychiatrists globally, maybe 2 million psychologists, and now including together with the mental health nurses and other professionals, maybe could be around 6 million or so there. In Africa, and particularly sub-Saharan Africa, we have around around 0.1 per 100,000, psychiatrists, which is quite low. Again, even the number of psychologists, and even like now looking at Kenya, we are supporting. We only have around an average estimated around 150 psychiatrists in Kenya, and around 2,000 or thereabout maybe mental health psychologists, or what you'd say clinical psychologists. Now, when you think about the Kenya, the key issues that have been found to increase, say, mental health issues could be also use of substances, and maybe even increased, which has been noted to increase suicide risk 14 times compared to other factors. And you'll find that particularly substances that maybe we've not known so much. The opioids are known to also contribute around nearly 20% of that, among others. But just to note that the current rate is that it's known that every 1 in 4, and if I would be more specific, is that 1 in 4 people who attend are known to have 1 in 4, I would say, people who attend outpatient clinics are known to have a mental health condition, and that means around a quarter of them. That means that it's an issue that is I'm lacking the right word there, is a major issue that needs to be addressed and needs to be attended to. So basically, maybe that's what I would initially just say, and especially noting that depression itself is the major condition that has been known. Looking at maybe even suicide rates in Kenya, which is again the data is not so much accessible, but number of deaths related to suicide, say like in around 2018, was around 70, moving and has been increasing every day, and it's highest among men. Why among men more? It's because by the time a man decides to that they want to die by suicide, then they cannot be able to, they have not even spoken to someone else. They've explored all the options and they found that they only need to die. By the time a lady feels that they want to die by suicide, they've spoken that to so many other people, and that's why they are able to get support. So this situation, of course, compounded by the current legal situation that has been there, has initially made it a bit more difficult to access mental health services. But I'm happy to report that lately, as a country, of course, the nation has made great strides. And because of the enactment, and maybe because we have a lawyer in the house, maybe she'll be able to speak to that. But just to touch that, we have what we call the Kenya Mental Health Act, which of course was again amended around in 2022, and then even in last year to focus more on the rights and the care of persons with mental illness, whereby like now the recent amendments include the community-based care, the patient rights, and of course the part which was latest, the decriminalization of the suicide attempt. Of course, even all these are also included in, enshrined in the Constitution of Kenya in terms of the foundations as rights, of each person to health, and more so also the Counselors and Psychologists Board is one other act which was also passed in 2014, of course revised, I think it should be in 2019, the Act number 14 of 2014, and especially primarily to govern the profession of mental health, and also to be able to standardize and ensure that at least we are able to focus on the right growth. There is also the Occupational Safety and Health Act, what we call the OSHA, and which is 207, which especially part section 76, which is a requirement where we talk about the need for safe and healthy work environment. So basically, I would say that currently it's a major need, and we need to focus on this, and that's why we need to ask ourselves, how do we ensure that at least every person, be it that person who's in school, be that person who is in the workplace or even at home, how can we ensure their safety in terms of their health in every area? And as WHO would mention, that the key focus when we are defining even mental health, the emphasis is more than just the absence of that mental illness, because it's easy to think about the disorder itself, but more so trying to emphasize on the overall psychological resilience and the functioning of that individual. Yeah, thank you.
Thank you. Thank you so much, John. for that. Those are very useful insights, which we'll focus on a little bit deeply as we continue with the conversations, and especially when we're looking at the manifestations either at home, in workplaces, or even, in schools. How does that manifest? And Irene, I'll bring you in a second, but can we hear from Betty as well? At what point did you realize that you were struggling mentally, and how did it look like? And even when it comes to the support from the people around, either in families or even at work, what was that like for you?
Thank you, Winnie. For me, I would say that I realized when I got out of prison. That was in 2018. And having gone through the criminal justice system, the grueling court process, and then to get convicted and actually serve a sentence. And I can say throughout the process of the court process and being imprisoned, I was numb. So when I got out, it just like spilled over, and that's when I realized I'm in problems because I couldn't reintegrate well. I couldn't handle the outside world, for lack of a better word. Outside prison, I could not be a mother. I could not be an employee. I basically just wanted to just sleep all day, do nothing, because everything that I had gone through was just coming back. And I got into some drug abuse. I had to take alcohol to just get by. And for a year or so, I was just like in that space. But that's when I met Clean Start. I joined the organization, and through the circles of healing. So these circles of healing is where other, formerly imprisoned women, they just come together and they talk, and it's a safe space, and they're just able to just say what you're feeling and what you're going through in a space where everyone can relate to what you're going through. And I also have to say, it was really hard for me to just get back because of the stigma that's associated with being in prison. You lose so much. I still have family that don't talk to me, and then I left prison in 2018. But up to now, I still have family that don't talk to me. But, I found a safe space at Clean South Africa. I went through the Ufunuo program, which really, really helped me to just get back into the society. And I think the best thing about it is, like, right now I go back into the prisons and I take the women there through the Ufunuo program, and, just to make sure that they don't go through the road that I went through, that even while in prison, they can still have, they can still have mental wellness, and they can be in the right mental space to just, deal with prison and also post-imprisonment. Thank you.
Thank you. Thank you so much, Betty, for that. And Dr. Crystal, allow me to bring you in here. When Betty talks about stigma and some family members probably not understanding, mental health, and when someone says they're struggling mentally, and even just offering that support, can we just understand first of all the stigma and in what forms it comes in? Because again, like you said, you also focus more on wellness as well, and you're a medical doctor. Can we just understand stigma in itself and the different forms that it comes, and speak a little bit on support as well, and why support is important in this case?
Yes, thank you. Valid question. We see a lot of stigma when it comes to mental health. And I'd say that the stigma presents in, it comes from either within the individual or in the family units, as has been mentioned, or from society as general, informed by, culture, upbringing, personality. So individually, you'd find that somebody, because of the idea that they have regarding mental health, a lot of the time, guys grow up thinking maybe somebody that has mental health challenges can only be the person that's walking down the street picking things in the street. So if you find somebody like that and they are told that they're facing a mental health challenge, or that they start to suspect that they might be having something like that, then of course within themselves they are in denial. They are telling themselves, it can't be, because I'm not walking out in the street, I'm not, either not clothed or wearing all my clothes at once, then I am not having mental health challenges. And so this individualized stigma really now drives a big barrier to seeking mental health support and services, because again, if I'm not sick, why am I going to see the doctor, or why am I looking for a therapist? And then within the family, of course, when somebody is having these ideas as an individual, it came from somewhere. And you'll find that many families, it's not too long ago we would see on the news that somebody that has a mental health condition in a family being chained and hidden from the public view, because the family does not want to be associated as either having, bad genetics, or being cursed, or either religious or cultural reasons to that. And so you find that even if the person within the family would want to seek help or is out seeking help, they do not have the support of the family, number one. And number two, apart from not having the support, some are actually even being sabotaged. For example, being locked away in a place where they can't access healthcare and support and treatment. So that's how we see a lot of stigma from the family coming in. And then again, society is made up of families. And so you could have an individual that is okay with, their condition or diagnosis and is actively seeking help or support. Their family is behind them, but then the community that they live in, the village that they live in, now makes it hard or ostracizes them. Or cases like these within communities, you find they're being banished, for example, for bringing a curse onto the community or something like that. And we think we think we have modernized, we think that we've progressed so much, but it doesn't have to be, like village setup, chasing you away with sticks and stones. But even in the workplace, for example, you'd find that once, for example, if an employee has a mental health crisis at the workplace and they go through all the steps and they come back, with an active support and treatment plan, there'd be people at the workplace that would still now either distance themselves from them or start judging them. And that's also community. Those are the main ways that we see stigma presenting itself personally, at family level, and within society. And sorry, the second bit of the question was what again?
We were trying to figure out how stigma looks like and support as well. How can family members come in to support? Because like James said, it took friends and some of the family members to really help him, first of all, understand, what depression is, and help him also to seek help.
Yes, thank you. So, again, support could look like very many different things to different people, but the main ways in which we see support are one, through validation. So, your friend, your brother, your sister, your parents, just being there with you and telling you that we understand that this doesn't make you a bad person. It doesn't make you a failure. It's an illness, and we are willing to walk with you, because, again, it's very challenging to be on the receiving end of the mental condition, of the mental illness. For example, let's say somebody with, let me speak of schizophrenia. You, as the person with the schizophrenia, you sometimes you have a difficult time telling what's real from what's not real, and just having your family there with you and supporting you through as you work through the self-acceptance and getting to the point where you're going through treatment, that really goes a long way. Another way is financially. You find that there's a lot that goes into treating or accessing mental health care, be it medication, be it admission or outpatient visits to a psychiatrist, to a psychologist for therapy. All these costs add up. And so if your condition does not allow you to work or to keep a steady job, then you find that friends and family support comes a long way, either as paying out of pocket or taking out an insurance cover for you to facilitate that treatment, giving you a safe space to be and to recuperate as well. Knowing that you're always welcome back home. You are loved at home. Nobody can disturb you out here because you can always go back to where you came from, that you can always crash at your friend's couch, for example. That's also a big way of showing support to people that are affected by mental health conditions. And even just sometimes the people around you will realize that you're struggling even before you do, and them being in a position to hold space for you so that they're not pushing it. It would be very different if somebody came to me and told me, I think you're not okay, and I'd immediately get defensive and start fighting against it, versus just them seeing it and silently supporting as I walk the journey of getting to that point. And so those are some of the ways that we can give support as friends, as family, as colleagues, as employers, even in the workplace, for people that are having mental health challenges. And hopefully it turns around and comes back to us when we are in need of the same. Thank you.
Thank you. Thank you so much, Dr. Crystal. And we'll come back then to you to understand when we talk about affordability and even access to treatment, a lot of people would say, listen, in the country, access to healthcare in itself is expensive. And now you bring in mental health, which is even more expensive to access. So then how do you come in as Minet or as insurance provider to just help ease that burden for so many people who might be struggling, with struggling mentally rather, and also financially, at the same time in trying to seek for help. But Irene, let me bring you in now. Dr. Crystal has talked about mental health at workplaces and how it manifests, but really, do you want to bring us into really understanding, first of all, the role of the employer and the employee as well when it comes to the work environment and how it would impact a person's mental health, and then probably speak a little bit on the rights as well.
Thank you so much, Winnie, for the invite, and I'm really glad that we are having this discussion. And as I think one of the speakers who has gone ahead of me already mentioned, that as a country we've made some good steps as compared to maybe 1 or 2 decades back, from a policy and even legal framework to handle mental health in many spheres. But I think for me, I'm talking more from a workplace perspective. But even from a workplace perspective, as much as we do not have a I would say standalone legislation that deals with handling mental health or wellness at the workplace, we have some legislation in fragmented ways, but also case law has enriched this space. So if I could just maybe answer the first part of your question, is that what are the obligations of employers, and also what are the rights of employees. But also maybe I will not just focus on obligations of employers, because if you look at one of the policy documents that the government has issued in the recent past, I'm talking about the guidelines that were issued, the national guidelines, but that were issued by the government in 2023, they're not yet, it's not really a law, so it's therefore a policy guideline, but it has very rich provisions on what the role of each and every one of us is in the workplace. So starting from employees themselves, let me start with employees before I go to the employers and even, the governance structures in a workplace. But starting from employees themselves, employees, we have ourselves as employees, we have the duty to, take care of ourselves. So self-care, but also, have some coping mechanisms to the level that is, feasible, but also looking for social support and also seeking mental wellness and care. So those are just some of the examples of what we employees are expected to do, and I'm just borrowing from the guidelines that were issued by the government in 2023. But going to the now the employers, what are employers' obligations from a mental wellness and health perspective? They're all listed. There are quite a number listed in the Mental Health Act. I'm now going to the Act, but if I could just give, and also the guidelines have all that. But if I could just give a couple of them. Let me start from what the guidelines say. The guidelines, for example, say that managers and supervisors within a work setting have the obligation to provide a supportive working environment. A supportive working environment could look like in many ways from workload, avoiding burnout, ensuring that, harassment and how to handle harassment in the workplace, and putting together, wellness programs, which I think is a very big pillar of the guidelines that were issued by the government in 2023. But secondly, also to identify those that are at risk. So in terms of not just having a supportive work environment, but also supporting those that are at risk, identifying first of all, and then offering support to those that are at risk in as far as mental health is concerned. And also, in addition to that, is allowing time for employees to seek help. And from a legal perspective, of course, we have sick leave provisions under the Employment Act. But I'm always glad to note when I look at employers' policies to note that most employers actually have very generous sick leave provisions over and above the minimum that are provided for in the law. For example, the law, that is section, I think, believe 28 of the Employment Act, as read with the general order, provides for 15 days and 30 days at full pay, half pay, and then some employers also have policies of now extending that to 60 days, 45 days, over and above the minimum that is provided for in the law, which is really a good thing. But over and above this, we also have principles that have been developed in case law, how to handle workplace, mental health, wellness and mental health at the workplace. And two things is what the Supreme Court has said. The Supreme Court has said two things, that when handling wellness, generally, whether physical or mental at the workplace, the employers must bear in mind two things. One, they must handle each situation with care and sensitivity. So that's the first thing, care and sensitivity. And then secondly, they must provide reasonable accommodation to employees before an employer even thinks of whether this employee should be exited or retired on medical grounds. They must provide reasonable accommodation to a sick employee. And this sickness is just not physical sickness, but also mental sickness, and mental wellness or mental health is also taken into account. And the Supreme Court has laid down these principles that employers should have in mind. There are many others, but maybe I could just highlight those. But also from a governance perspective, leadership. What does a leadership in a workplace need to do to ensure that there's a conducive working environment? That is one. And then to approve setting up of these wellness programs, approve policies, of course, set up budgets if there's a need to expend money to take care of these programs, but also provide all other reasonable support to ensure that wellness programs are taken care of in the workplace. If I could just wind up with maybe you are asking about what are then the rights of those who are suffering from mental illness at the workplace. Those are there are many that are listed in the Mental Health Act, but one of them, of course, is to access for to mental health help or support from a medical perspective, so such that they can fully participate as any other person, because of course, there are some cases that are very serious where those suffering from mental health are not able to maybe participate in activities that promote their social, physical, or mental well-being. But to the level that they are able to, the Act entitles people suffering from mental illness to take part in activities. And they can only take part in activities if, of course, they have been, granted their right to mental health services that is provided for, a right that is provided for under the Mental Health Act, as amended in 2022, 2023. I think 2023 was the most recent amendment, but also over and above to the right to mental health services, there are other rights that the Act also provides, which is, of course, consent to treatment, because persons suffering from mental health still has the right to give consent to the level that they are able to, but in the event that they're not able to give that consent, then they need to, the Act provides for a supporter or a representative to, of course, represent them. But maybe I could just highlight maybe two other things, and I think we've seen this a lot in the country, where a person suffering from mental illness has a right to participate in treatment planning. They have a right, they have a say in when the professionals are coming up with treatment planning. They have a right to participate to the level that they are able to, so that in the event that they are not able to, then we have a supporter or a representative. And I think we've seen a couple of, I think we saw a very sorry state sometime, was it early this year or late last year, when it was up in the media that a patient who was sick was not able to fully participate in the planning about their treatment. Access to medical insurance. I think I can see one of our speakers here is from the insurance industry, but the Act actually is sort of like the ensures that medical insurance providers do not discriminate against, patients who are suffering from mental health, so that both from a private and public health insurance providers, the Act requires that mental health is taken into account. I think there are so many things to say. Maybe I could stop there, Winnie, and I can come back at another stage. But there's so much to say from a legal and policy perspective. But maybe actually before I pen off, let me talk about slightly from an international perspective, international labor perspective. From an ILO, which is the International Labour Organization, which is the entity, the UN entity, specialized entity that comes up with international labor standards, places a very great premium in occupational safety and health. So not just from a physical perspective, but also from a mental perspective. And as recent as 2022, occupational safety and health was declared, or was deemed to be, a fundamental principle and right at work, which means that all member states, all the 187 member states across the world who are members of the ILO, must give a lot of emphasis and must put mechanisms in place to ensure the safety and health of employees, and that extends to mental health at the workplace. Maybe that I could stop there for now and maybe come back later. But I thought it was important for me to highlight also the international angle to it. Thank you, Winnie.
It really is. It really is. And thank you so much, Irene. We'll also come back to you to understand how much of this rights, first of all, do employees know, and are companies, organizations, institutions sort of like obligated to communicate this right to the employees? Because I'm sure you've had a lot of people say, I'm scared to even voice out to the HR that I am not doing well mentally and I would need some time off. And some would say maybe that will be used against me when it comes to, say, like redundancies or people getting fired and all those things. So we'll come back to you to really understand how people can go about it. Do people even know that, they have this right? But John, allow me to bring you in, and then I'll go back to James and Betty in a second. Most of the time when we think about mental health, either condition or disorder, we usually just, the first thing that comes to mind would be depression. But do you want to speak on the different types when we talk about mental health, conditions or diseases, and how, say, from a professional, you would be able to, yes, highlight and say this person is struggling with this and not this, because depression is one of those terms that we use carelessly. If, say, someone is having a bad day or they're stressed, the first thing that they would say is, I'm depressed. You know me, I'm depressed. You know me, I'm depressed. Not really understanding the gravity of just that term depression. So probably just take us through that. John, if you're speaking, your mic is still on mute. Kindly unmute.
Hello. Oh, yeah, sorry for that. And again, thank you so much because of that, and of course, even thanking you, my predecessors in this panel. And I agree with you that depression is one of the most common condition, and it's casually used when we are talking about overall mental illness. And looking at, I know I had alluded to this a little earlier, the overall mental health landscape. Of course, when you talk about 100 million people in Africa suffering from clinical depression, and out of these, 66 million of these are women. And of course, itself being the most prevalent mental illness in the world. That's why it's easy for people to talk about that. And particularly when Betty and James were speaking, it made me think, remember that in the morning, I was just asking myself, why would this conversation be very, very important in a day like today? And it made me remember that we already celebrating this suicide prevention month. Next month, we'll be talking about World Mental Health Day, and even the month, we look at it as to remember people who are suffering from that. And the reason is because even data from Kenya itself, as I had said, 1 in 4 people suffering from mental illness. The burden among inpatients being around 40%. And of course, we know so much about psychosis, which generally, even in the population, is estimated to be around 1% of that. So ideally, it's because we are saying this is a big percentage when we talk about around more than 500,000 people suffering from that. And some data that I'd picked a little earlier is that when you talk about 5 in 6 Kenyans with mental illness do not receive treatment. What is depression, and particularly what causes depression? And major causes of depression is mainly caused by, it could even include genetics, and especially a definition by WHO, where we look at the 4 areas when we are looking at a mental health condition that could have caused that. And the reason why this is again important is so that we are aware that anyone can have a mental health condition. So when we hear this data, it's not, it's true. And you find that there are 4 angles to this. So there is normally the biological angle, which means that it can be genetic from the family. It can be because of substances, as I said a little earlier, or even someone suffering from other medical conditions. And I'm sure Doc will be a better place to talk about that, like say the common challenges of cancer that could lead to stress. And again, other cause could be because of psychological factors. It could be maybe a history of abuse or even childhood experiences. I know we talk a lot about childhood traumas, but again, how do they relate in mental illnesses? Social factors, lack of psychosocial support, which is a major issue among men, and also other areas, say like even it could even include spiritual, cultural factors. And that's why even in our practice, we talk about the ethics about the practice. We are so much considerate about the ethical considerations, and most importantly, we talk about the cultural sensitivity. We need to be more aware of our biases and how it can affect our clients. Speaking specifically about mental health conditions, I know the depression, and it's known that it affects around 1 in 10 people during their lifetime. And particularly, women are twice as likely as men to develop depression. So globally, when we talk about 1 in 4 people in Kenya, globally it's normally 1 in 5 people. And it doesn't choose man, female, age. It can actually affect anyone. And the continuum is so that the onset is normally stress. If it's not addressed at that particular point, then it progresses into anxiety, and then it's the anxiety that then can progress into now the other conditions. So it's good, and it's very important for us to be able to notice this early enough, so that we can be able to understand that person, say for example in the office, who's going through a difficulty, they have started isolating themselves. They are no longer participating in activities that they used to love participating. So when you notice that kind of a person, it's good that you just encourage them and to either check what's happening to them. Are they going through a difficult moment? Are they working through maybe a breakup or something like that, or something that is more difficult? And this is where now the role of each and every one of us comes in, so that we can be able to support. So basically, some of the early signs of depression and overall even other mental health condition is when you start finding that someone is basically isolating themselves more. When you start finding that someone is getting more worried or more irritable even more often, so that a small maybe provocation would lead them to become irritable or even agitated, yeah. They start feeling overwhelmed, and even to check things like disrupted sleep or even just overall low energy. And even this could progress to other things like difficulty concentrating, difficulty maybe sleeping. And those are some of the common signs. And it's good to understand that the stressors can come from different places. It can come from workplace or school pressures, because there are expectations. There is that emotional overwhelm in terms of expectation, whether it's at work to meet certain targets, whether it's at school, like we are in this season where schools are just about to do their exams. So there is high, pressure in terms of emotional expectation or overwhelm. It could also be coming from things like financial difficulties and other major life challenges, whether it's moving to a new job, whether it's even getting married. That transition is normally not easy. So I think for me, how I would look at it is that it's good that we address the situations, or rather the issue, early enough during that moment of stress, before it progresses into maybe anxiety and later into other conditions, and particularly depression. There are other conditions in when we talk about mental health. Of course, we could talk about trauma. I've already alluded to anxiety. Could be generalized anxiety, which means it's that feeling like life is all over the place, and it's disrupting sleep. It's disrupting the way someone is working, and other could be maybe like psychotic conditions, that which comes with now specific disorders. It could be that someone is experiencing, say, hallucinations, or where they are seeing things that other people around are not able to see. They are feeling things, say, for example, touching or walking through their bodies, and other people and other people cannot see maybe anything like that happening. They could be hearing voices of people speaking to them. And then other could be experiencing, say, delusions, where they feel that someone is trying to or rather they have strong beliefs around a certain area which is not realistic. Say what we talk about, like being hyper religious. So they are actually feeling like they have the powers, like God would be able to do that. So different signs. So our work is to just be able to identify those early signs early enough, and be able to work around that. So again, could be other personality conditions, could be substance use disorders. And when I talk about substance use disorder, I alluded to, say, opioids, which is not very common. We talk about heroin, we talk about, say, cocaine. Weed nowadays has become a common drug. Yes, we can use it to remember, and we don't judge you when we are offering support, because we are saying initially, maybe when someone started using this, it was a support mechanism to be able to protect themselves. But then as they get used to it, it becomes an addiction. It could be gambling or other disorders related to such. It could be also maybe even suicide itself, having whether passive or active suicidal ideations. It's important to be able to notice that when you start having feelings of helplessness, feelings of hopelessness, because either the pay that someone is receiving is not enough to be able to sustain their family, either feeling isolated by maybe peers or friends, or being bullied if it's in school, then this also is a condition that we are able to assess, and we have different ways we do that, whether it's a clinical interview, whether it's assessments, and then we can be able to offer support within the guidelines that have been laid out here within the law, making sure that especially we are ensuring ethical practice, like ensuring confidentiality. So basically, there are many other conditions, but I would want to pause there first, and maybe I would come back later. Thank you so much.
Thank you. Thank you so much, John. And it's true indeed. Mental health comes in different forms, and it can affect anyone. It does not really discriminate. And also, speaking about the importance of seeking help as soon as possible, so that it does not progress to something that is a bit complex to treat or even become a disorder. I'd like to bring in James at this point. As far as your journey towards seeking help, what were some of the barriers or challenges that you experienced when seeking help?
All right, thank you so much. Okay. One of the major barrier was stigma, and this was both societal and personal stigma. Because growing up, mental health wasn't something that we can talk about, because we didn't even know mental health exists. So even you, like, let me say you're going through something, but you don't know like how to label it. So even to get out of it, like now need to seek kind of help. You love that stigma. Like this culture that, surround, I'll talk about the main perspective that when you are seeking help, they label a weak person or they start to mock you. But for me, after just getting to know myself and admitting that I'm truly struggling with something that now I know the name, I started to reframe now the mental, just to start seeking the healthy coping mechanism. And this started by just joining a peer support group within our church. And from there, we had like time also just to share our stories, how people are, embracing their struggles when it's come to mental health. And that's when I also had the opportunity to learn like things like, journaling. When you're feeling like you're a bit badly off, you can even go for a walk, do things that brings you joy, or even write a book, because I like journaling, and that's also helped even to develop my book, just to talk about my story with mental health, and also just the societal norms and how we can disrupt, challenge, and address this harmful cultural norm that equate masculinity with emotional silence, so that we can use our story to help those who still find it hard to get up, speak up, to get the necessary support that they want when they're going through mental health. Because at the end of the day, we are all human beings. We go through some challenges and we have feelings. We need to accept that. And after accepting that, having that self-awareness, and where do I now start to look for this support? And this can start from, let me say, the trusted friend or the family member, or from even the church spaces. And from there, you'll truly get a support system that will help you navigate your mental health. Because mental health is a continuum. We have those high moments that we feel good. We also have those kind of low moments that we feel that things are not working. And if things are not working, what do we need to improve just to make sure like our mental health is on check, so that we can continue to be productive within our spaces, and also just bring that hope to our family and also in the community moving forward. Thank you.
Thank you. Thank you so much, James. And I'll pass the same question to you, Betty. What were some of the challenges or barriers that you encountered when seeking help?
Thank you once again, Winnie. Just like James said, stigma is quite an obstacle, because the people who you think will be there for you, keep a distance. And now you're just in that space, you're struggling alone. You're just trying to just figure things out, and you'd hope that your friend or your family would hold your hand, but they're not doing that. So stigma is quite a challenge that I came across when I was just trying to just heal mentally. Another challenge I would say is affordability, of the therapy sessions or counseling sessions. They're not cheap, and when you're coming from prison, you've lost everything. You've lost everything. When you went in, you're coming back to nothing. And most of the women who go into prison because of poverty, and they come back to poverty. They cannot afford therapy sessions. And they, even just getting a job, how do you explain to a potential employer a huge gap in your CV? You are away for 10 years, and to make matters worse, you do not have a clean certificate of good conduct. It has a mark that you are an ex-convict. So it just makes just affording, you know, therapy session or counseling sessions to be it's very hard. You cannot get that. And so once again, I just come back to what CleanStart does. They offer these services for free, those mental wellness services. And when you get to the organization and you're formally imprisoned, you get those services for free, and you're just able to get someone to hold your hand. And, we also have volunteers, therapists who just volunteer their services, which has also gone a very long way to just help so many women to just get back into the right mental state. Yeah, thank you, Winnie.
Thank you very much, Betty. And you also bring up a very important point as far as reintegration is concerned, reintegration into the society, but also into the job market. And Irene, I want to bring you in because before I forget that the whole aspect about then reintegration, going back to work, and especially after, say, taking some time off to just heal and go through treatment. And does the law speak to that in terms of how do you go about it to also protect the employee from cases of stigma as well and discrimination? And then I think John and Dr. Crystal will also speak about reintegration back into the society, back into the families, back into schools as well, how that should look like. But Irene?
Yes, Winnie, the law speaks to it, but in very thin way and not even very express. I can't figure out in my mind a very express provision that really mandates, employers in as far as reintegration back to the workplace is concerned. I think my colleagues can talk about other aspects of society, but let me talk about the workplace. But the law talks about it, for example, from principles in case law. And it just goes back to what I had said earlier on, is that an employee, of course, is entitled to take time to, seek medical attention, to take care of their illness and come back to work. But also, the workplace is let me talk about from a private sector perspective. At the end of the day, the employment contract is a contract where there is services that an employee gives, and there is, the remuneration that the employer pays to the employee. So the law, and I'm referring here to a Supreme Court decision, though it entailed physical infirmity, but the same principles still apply in mental infirmity. What the Supreme Court said that you as an employer would not terminate employment of an employee who is sick unless you have really given them sufficient time to resume work, and you can only retire them on incapacity if you have actually proven that you've taken, you've taken into account care and sensitivity. Of course, they have exhausted all their leave days, sick leave, and they have sought medical attention. They have been reasonably accommodated, and maybe that's where maybe reintegration comes in. Reasonable accommodation looks like, for example, modifying the workplaces to suit a sick employee, modifying work hours, maybe changing work hours, redeploying an employee maybe for lighter duties. We've seen cases to that extent, and other reasonable accommodation. But the Supreme Court has given a rider to employers that to the level that is attainable, to the level that it does not give also the employer hardship in complying with the requirements of reasonable accommodation. So I will say yes, to a certain extent, reintegration back to the workplace is possible, and the courts have laid guidelines in as far as that is concerned. But we have also seen cases where the courts have actually said, here the employer has done all that they could, and it got to a point where this employee really had to be let go on incapacity, because the law actually allows an employer to let go of an employee for cause of incapacity, and that includes mental health. So it's a very a balance that must be struck, where the employer, of course, expects that the employee, gives value in as far as the contractual obligations are concerned, but the law has placed a lot of obligation from a case law perspective to ensure that also an employee is treated with dignity and reasonably accommodated care and sensitivity, and allowed as much as possible to reintegrate back to the workplace before the employer can actually consider exiting them on account of incapacity.
All right, so a bit of a gray area there. Do you also want to speak a little bit on the gaps that probably you feel exist,
Yes.
and especially when it comes to mental health and the legal aspect of it, and what are the potential ways that, say, we can close that gap or maybe strengthen, and then we'll come back and talk a little bit about then the policies that exist or should exist if they don't.
Okay, fine. I think that both of those questions, I think I can answer them because they're a bit related in the answer that I want to give. I think one of the biggest gaps is what you alluded to earlier on, is lack of awareness. Lack of awareness from an employee's perspective, but also from us supervisors and the employer's perspective on how to handle and treat mental health at the workplace, such that the policies that you'll find in the workplace, in as far as mental health is concerned, are fairly thin, and maybe that leads to that arises from a gap in the law, because, as I said, the law that governs mental wellness at the workplace is not very comprehensive, is fragmented and mostly guided by case law. So maybe it's a high time that there's legal reform that actually speaks to how we need to handle mental health at the workplace. And a very good starting point were the guidelines that the government issued in 2023. I think they give a very, very good starting basis to provide on, because they provide, as I said earlier on, what are the obligations of all the various actors in the workplace. And so that is, as I see, one of the biggest gaps from an awareness perspective, and also gaps in the law on just what the employer's obligations are from a workplace perspective. I know the Mental Health Act talks about obligations generally, but I think they need to be nuanced from a workplace perspective, just because of the unique circumstances that a workplace brings, because the truth is that an employer would not keep sick employee in the workplace for in an open-ended basis. They will get to a point where they take a decision and exit the employee. So, and therefore, the principles that we've gotten from case law, I think, if they are codified into statute, that might be much better. Or as we wait for that to be done, I think just growing jurisprudence in as far as that is concerned, because health and safety is really it has a constitutional underpinning. Article 43 guarantees each and every one of us as Kenyan citizens to the highest attainable standards of health, and of course that will extend to mental health. So I think those are the biggest gaps that I see, and I think how to address them is really what we are doing now. So talking about these things, identifying gaps, lobbying for legal reform, and just growing jurisprudence in as far as handling mental wellness is concerned. Because as I said, and why I'm saying growing jurisprudence, my last point is because we already have laws that speak to some of these things. Like, for example, stigma and non-discrimination that my colleagues were speaking about. We already have laws in as far as that is concerned. Section 5 of the Employment Act, Article 27 of the Constitution, and even Article 28 that talk about equal protection and freedom from discrimination. And even when I look at Section 5 of the Employment Act that protects against against discrimination on protected grounds, and one of the protected grounds is health. So we have laws that are already speaking to some of these aspects, and I think the courts have started to do a good job in terms of laying down principles that then that speak to these principles that are already in that place. And maybe the last point I would like to speak to is that I think we are also seeing mental health and wellness at the workplace having different dynamics that were not there even maybe 5 years ago, 10 years ago. And one of the things that I read recently from an ILO write-up is something called technostress from a workplace perspective. Technostress, where there's so much use of technology and maybe so much expectations where you're expected as an employee to give feedback at speed that you were not doing before, or there's so much screen time that in Teams meeting, Zoom meeting, in a very extended periods of time, such that technostress is now being looked at as also a wellness issue at the workplace. But there are many ways of handling this. I think you must have had a lot of talk about ESG, which is environmental, social, and governance protocols that should be put in place, and the S part of ESG, where many entities are now looking at being ESG compliant. Many entities, I think many investors who are coming into, maybe funding businesses, startups, PE and equity, private equity, are actually looking at, is this entity ESG compliant? And part of the S in the ESG has to do with well-being of employees, and well-being of employees, not just physical, but also extends to mental. So what am I saying? I'm saying that there are many avenues that we can still use, even as we wait for any legal reform or growing jurisprudence in this area that can handle mental health at the workplace in a balanced manner that takes care of employees' interests, but also employers' interests and any other stakeholders in the workplace. Thank you.
Thank you so much, Irene. John, it will be interesting also to hear from you on on technostress and what that looks like from a psychological point of view, and again, if there are ways or things that we can do to prevent. But Dr. Crystal, allow me to bring you in here, and then John, I'll come to you in a second to speak on reintegration. As far as, because what we've heard from James and Betty is that access to treatment is almost impossible for so many people, and we all know how we as a country, we as a community, and talking about Harambee culture, I'd want to imagine a situation where a family will say, hey, listen, we're not able to afford this treatment. How about we hold a small Harambee? It's something that would be frowned upon because there's still cases of stigma and discrimination when it comes to mental health. So please speak on how financial barrier is such a big impediment to treatment, and how that largely then contributes to even the complexity of either the condition or the disease when it comes to individuals and families and communities as well, and as well as workplaces as well.
Right. Thank you, Winnie. So yes, financial barriers are one of, if not the most or the biggest barriers to access of, medical treatment and even mental health treatment. And this manifests in, I'd say, in the context of our conversation, 3 major ways. And so the first one, as you have mentioned, is that we we find ourselves as people, as families, having to pay out of pocket for access to mental health and treatment. And so in this case, you find standard therapy sessions, I think, go for from a minimum of around 2,500, 3,000 if you're going to see a therapist per visit, and then you have like maybe 1 or 2 sessions with a therapist per week for X number of months. Those costs add up. You have medication for mental health conditions, tablets, injections, and these are not, one-off drugs. They're drugs that you have to take consistently, continuously, and most mental health conditions are chronic conditions, so the timeline for treatment is indefinite. Again, you can only hold so many fundraisers, so many harambes for accessing treatment, because you'll be in and out of hospital every now and then. That increases your personal burden, your familial burden, and then also you'll become known as the people for harambes all the time, just furthering the stigma cycle. The payment of the out of pocket payments are the biggest, I'd say, driver of the financial barriers to access. The other thing is, again, inadequate coverage. And so, yes, even when you can augur the means for treatment, the financial means, getting to where treatment is, getting to a psychiatrist that can see you, getting to a therapist, especially if you're not, within Nairobi or the main metropolitan areas. Again, those are additional costs. You have to get transport, maybe accommodation if you're traveling a really long distance. So driving the costs even higher, increasing the financial barriers. And now the third thing is, as has been mentioned, with regards to employment, and not just in the sense of you in the workplace and how the condition affects you, but also for every visit that you need to take once a week, twice a week to the therapist, 1 week admission here and there, it takes a toll on your work and your perception at work. So as Wakili said, some employers are lenient, some employers are supportive. Others, for example, if you work as a mamafua, as Jengo worker, for example, it's very hard to imagine that you'd tell your foreman to hold your post if you're out of work every 2 days every week. So you're weighing between the cost of treatment on the one hand and earning for your survival to afford the treatment, and you just get trapped in this cycle that drives the cost, the financial and other implications of that as well. And so we usually say that okay, sorry, before I go into that, I'll just say now what this cycle looks like with the financial barriers to access for mental health care is that now we have underdiagnosis of cases, because then not anyone, or not a lot of people, can afford to even have that initial screening to check and see what could I be suffering from, what could be ailing me, and start a treatment plan. And so the more the underdiagnosis, the fewer the people that are getting diagnosed and being started on a management and coping plan, then you have the conditions worsening. Something that could have been that could have had an intervention much earlier gets worse and worse, because a lot of mental health conditions, again, are progressive. It starts off mild or moderate and gets to severe and extreme as time goes by without treatment. And so you have a worsening condition. When your condition is worse, treating it is more expensive. You're more likely going to need admission in a facility, public facility, private facility. Remember, we do not have many mental health facilities in the country. So if you don't get space in the public ones, for example, and you have to go to a private one, what happens again? It's even more expensive to be admitted at most private mental health care facilities. Again, the worse the condition, the more the absenteeism, the higher your chances of job loss, of losing your income, worsening the financial cycle. The financial stress adds to your mental health condition. So it's just a very vicious cycle that, comes up with the cost of access to healthcare. And again, in working systems, the easiest way to circumvent the issues of access to healthcare regarding cost is always insurance. And you have the public insurance or the social insurance and the private insurance. Like, we work within the private insurance field, but in the public insurance field, and in our country at the moment, we have SHA with its pros and cons. But if you look at formulation, for example, implementation aside, what was offered, what if implemented would really work in driving these costs very low, is that with the primary healthcare network model, at your level 1, level 2, level 3 facilities, it was envisioned that at the premium that you pay per month, you'd be able to access screening, testing, medication, and follow-up at no additional cost. So for anybody that could pay the premiums, they should, or they were to get these services at the most basic levels of healthcare, at your dispensary, at your neighborhood clinic, for example. And so that includes psychosocial support that should have included counseling if framed correctly. Again, we are having issues with implementation, so whether it works or not, but ideally this is something that would have really worked to drive the cost lower and hopefully see many more of us being able to access mental health care at affordable rates, including even, admissions, emergency response and treatment, resuscitations where necessary, etc. Again, you come to now, even in the private insurance field, a while back, a couple of years back, there were very many conditions that were excluded. Even if you are getting a healthcare cover, they would say, oh, they don't pay for mental health outpatient, or some of them don't pay for mental health inpatient. But as time goes by and as the emphasis on mental health and mental wellness being part of general health and good well-being for the whole person, looking at holistic medical care, then you see that as days go by, more and more underwriters are now accommodating mental health conditions. And so while insurance premiums are still high, and for many people they're accessible mainly through their employer programs, you find that now with innovation, several underwriters, several insurance companies within the country are offering like lipa pole pole programs where you pay a weekly amount, a monthly amount, and you're able to access care. And so I believe that if we are committed towards really pushing for mental health wellness, as a country, as a community, as industries, we can definitely find ways to make this more accessible and affordable for treatment. Because, they say there's no healthcare or treatment that is free, but something has to pay for it. But if we can drive innovative ways of payment, then we can have very many more people getting the mental health care that they need. And yeah, happy people, happy society.
Well said. Happy people, happy society. And where there's a will, there is a way. All right. Thanks. Thank you very much, Dr. Crystal. All right. So we'll be opening the floor in the next 5 minutes for questions and also contributions to the discussion. So please remember to keep it short and straight to the point so that we allow as many people to either ask questions or to contribute as well. And also just a reminder that today's X space forms. It's sort of like a preamble of a bigger conversation which will be happening on 30th of September from 8 a.m. to 5 p.m. at Imara Ole Sereni. And the ticket goes for 9,500. And for details, please call the number 0727946143. I don't know, Wanja, if we were able to pin that on the comment section, just in case there's some people who'd want to know more about the ticket, and the number to call, but really the number to reach out to is 0727946143. And we really, really look forward to seeing you on 30th of September. But John, allow me to bring you in. You have around 4 minutes to speak on reintegration and also treatment, because sometimes you'll see family members who would or even colleagues, say at workspaces or even in schools, where people are like, just snap out of it, snap out of it. You're not the only one who's going through something and all those. So there's always those low tone conversations that really contribute to stigma. So kindly speak on that, and also speak on reintegration as well. How do we do that so that people who after treatment go back home or go back to school do not face even bigger stigma?
Okay, thank you so much, Winnie, for that question. You noted that I was eager. I was looking forward to that question. And the idea is because for me as a clinical psychologist, I look at reintegration as more like an opportunity to reassimilate this person, to enhance more connection, and to kind of rebuild their identity so that they can now bounce back, or what we'd say resilience. And of course, this is a journey, and I think I would like to pick it up from where I think Dr. has said we enhance affordability and access in terms of innovative ways to payment. But for me, I would also add innovative ways of delivering the services that we can be able to do so that we can enhance even access. And particularly when I look at reintegration, I think a core thing is that it's good to ask ourselves that, say, for example, and I'm happy to see James, Betty, people with lived experiences sharing their real life stories here. And the idea is so that we can be able to relate more with this. And when you think about it, and this has been alluded, is that when we are, say, for example, thinking about someone who's been in prison before, then of course they are traumatized. So whatever therapy that we are going to do is that it needs to be trauma informed, so that we can be able to help them relieve that trauma even before they get back to the society, even before they get back to, even if it's the workplace or even in the family. When we talk about say employees having that kind of a pre-assessment before they get back to work, so that they can be helped to enhance their psychological or even you'd say emotional readiness to be able to resume back to work. You realize that after being away from, say, a workplace, and depending on the circumstances that sent you out, this kind of a person may develop some level of anxiety, so they need to be supported towards that. So overall, a reintegration plan should include, of course, the clinical elements, and also other engagements, of course, with the HR. And we have various, of course, initiatives or interventions that we can be able to use to be able to support that. So for me, even if it's a student, again, remember that if after a break, say, for example, after a traumatic event, or even just disengagement by a student, then it's good to also ask what are some of the other, maybe even psychosocial factors that are affecting this person, developmental factors. And and I would say, because I think the solution we are offering is, how do we adopt also innovative ways of being able to enhance that access, enhance that affordability? And I can say, like, even for the organization I work for, is that they try to, as much as possible, to check how else can we enhance that access, be it this is a telemedicine company, telehealth company, so that you can be able to access more people where at their convenience, and even away from the central, which is in Nairobi, say, for example, into the counties and the like. and maybe coming up with innovative programs, a program that support, say, for example, workplace situation, like what you'd call the employee assistance programs. So developing those kind of programs would help to be able to reach more people. And even when it matters, things like families, we also, when we are doing reintegration, we involve family therapy so that we can help these people understand maybe how best they can support this member. So for me, when we talk about reintegration, I think and this is supported by many laws, and I'm happy Wakili was able to articulate all this, and particularly the Occupational Safety and Health Act, the Section 76, whereby again it talks about the need for not discriminating employees on grounds of mental illness, meaning that this is an important factor. So the integration process requires a lot of time, a lot of patience, collaborating with different clinical teams and specialists, whether it's even psychiatrists, neurologists, and people like that, understanding also the social elements and how this person can be able to get back to the community and still feel accepted and wanted. And then, of course, we working within the policy and the law and even the ethical environment, so that to make sure that we are also within the rights and also within the right place that we are supposed to do. So as a psychologist, I wouldn't want to look at reintegration as just being able to address be it the trauma or which symptoms, but more trying to see how do we reconnect with this person, walk along this person, and so that we can continuously, step by step, help them rebuild their lives. Thank you very much.
Thank you. Thank you so much, James. Wanja, I think I'll throw it to you now to take us through the next session as far as questions are concerned. And if we have some on the chat as well, please let us know and direct the question to the relevant speaker.
Thank you so much for that, Winnie. I hope you can hear me. I'm going to be
Yes, we can.
Thank you. I'm going to be reading out some comments, but at the same time, I'm also handing over the microphone to some of our audiences. I've handed over the mic to one Ondieki. So Ondieki, just prep your question. I'll get to you in a minute. Some of the comments we have, Jambi saying, having been on this journey since last year, I can actually say much need to be done, especially at work, because discrimination is too much. That's just a comment. And then you have Brian Kimutai, who is asking, what if the depression is coming from home much than in workplace that affects your condition in work? How do you go about that? Maybe I can read several, then we will select who to answer what. So another comment, another comment is from Gerishon Gashoki, who says Section 76 of OSHA mandates employers to, among other things, provide employees protection against mental strain. In your view, how can organizations provide meaningful support, especially in high stress or resource-constrained environments? And then there's also Frederick, who says, how do you help someone with low emotional support and low self-esteem on friendship and relationship? And just to answer Jose Amagut, who is asking if the space is recorded. Yes, the space is recorded and you can be able to listen to it even after this. It's still going to be on our page. So the same link, you can click on it, and that goes even to everyone else who joined midway. You can start listening from the very end after we're done with the session. Winnie, back to you before I hand over the mics to some of our listeners.
All right. Thank you so much, Wanja. I don't know if our panelists probably noted down the question so that we open the floor to our listeners as well to ask their questions so that we can answer them together. But Irene, I think the legal question, I think, is our question. Then the question on how do you help someone with low emotional support and low self-esteem on friendship and relationship. I think, John, you can take that. And then, or no, let's have Dr. Crystal handle that. And then John probably take the question on what if the depression is coming from home and much than in workplace that affects your condition in work. How do you go by that? I think, John, you can take that. But in it's really short and straight to the point. We can take, like, say, the first round of questions, and then we can answer them together. But also for those ones who are asking questions, please note who you're directing your question to. Thank you. So whoever has the mic, just shoot your question.
Kagema, I have added Kagema as a speaker. Kindly unmute yourself. Kagema Kenya, you are a speaker. You can unmute yourself and shoot your question.
Okay, Agema, I don't think you've not unmuted yet. So as you prepare, yeah, Irene, can we have you? Can we have Irene answer the legal question, and then we'll have Dr. Crystal and then John.
Yes, thanks, Winnie. I could take some of those. And I think I had about maybe 3 questions that some could be related. But the first one, I think, was a comment from Jambi, who was saying a lot needs to be done, especially from a point of discrimination at the workplace. And I agree. And I think a lot looks like what we had discussed earlier on. But awareness, training of supervisors, managers.
Irene, we've lost. Irene, we can't hear you. Or am I the only one who can't hear Irene? She's connecting. Okay. Dr. Crystal, can we have you answer as we try to get Irene back?
Yes. So that's an interesting question that's been sent my way. I will do my best to answer it, but John, if you have anything to add to the points, you can definitely do it after I'm done. So the question that I was addressing is how to help somebody that has like low emotional support and low self-esteem, especially with regards to friendships and relationships. And so I would advise that for somebody like this is somebody that you need to approach with a lot of empathy, a lot of patience, and I know I keep saying this and using this phrase, but also just holding a lot of space, a really big space for them. And so what this might look like is work with them to maybe identify where this is coming from. Did they have a rough childhood? Were they being bullied? Are they just coming out of a bad relationship? Have they undergone a traumatic experience? And I know that not all of us are trained mental health practitioners, and so there's only so much that we can do for our friends. But in as much as is within our abilities, being able to really listen to them, ask these questions in a very non-judgmental way, and explore this. And even if not insisting that they answer you, because now I've asked you if your childhood was traumatic, you have to give me an answer, but encouraging them, even if you don't want to talk about it, can you maybe journal? Can you write it down? Can you think through it before you sleep this night? Something like that. Just encouraging them to get into a reflective space and see if they can really identify what is causing this. And then now once they have that factor in mind, then now encouraging them to break out of it. There's usually that model that has a circle of things that are within my control and things that are out of my control. So whatever it is that is causing the low esteem, low emotional support, is it something that I can control within myself? If it is, can I change it? If it is not, then can I figure out how to remind myself every day, every minute that this is not my fault, this is out of my control, and therefore it should not affect me, and pushing that away. And so doing this repeatedly, again, I said approach it with patience, because they will not get better overnight. It will take time, and that's where now your patience comes in. I'd even argue that for you to be asking this question, that person does not entirely have low emotional support. They have you who's worried about them, unless, you know, yeah. And then every time you realize that, your friend, your sister, your brother is speaking from a place of, low esteem, I'm ugly, I am unlovable, just gently challenge that negative self-talk. Ask them to change that voice in their mind. Every time they have a negative thought, for example, think two positive things about yourself. And doing this over and over and over again until maybe you change the voice that's inside your head and it sounds better and more positive. That way, then you might overcome the same conditions. And again, like I said, if you're asking this about a friend, a family member, you're already modeling good relationships. You're modeling, being loved, being in a safe environment. And so this is what we should continue to do for them. And I think that this is one of the reasons that people say women have better support than men, because a lot of the times you find that men have been socialized not to, like if your friend starts saying negative things about themselves, now telling your friend, oh no, you're handsome. And people are like, why would I be telling a fellow man that you're handsome or you're fine just the way you are? But that affirmation, going beyond what might even make you uncomfortable, but modeling a healthy friendship, healthy environment for them to live in and to walk in, again, I think is something that would be very instrumental in changing this. And then sometimes you just find that something that could be causing low self-esteem is a skill issue, So if you're not good at speaking with people, taking your friend out to situations, of course, starting slowly and then going incrementally, but taking them to places where they can practice speaking with other people in a low pressure environment. So like maybe with your one other friend, then two other friends, or like in a friend group where games are the focus, so they're not really having to speak, and then socializing them slowly as that goes, again, should help in the situation. If you can, either encourage them to go to therapy or even pay for their therapy sessions to deal with whatever, then even better. And then keep affirming them, encourage them, celebrate their milestones. I trust that you should get from point A, and if not to Z, you'll get somewhere along, the spectrum. Thank you.
Thank you so much, Dr. Crystal. John, and then we'll bring in Irene.
Okay, thank you again, Winnie, and I agree with Dr. Crystal that it's true that particularly when you talk about friendships, when you talk about relationships, I'll combine it with the question on if depression is coming from home. And I would say that, of course, home is ideally the primary, foundation for where you should attain that emotional safety, that psychological support, and even recovery. So it's where we should feel, seen, that being heard or even accepted, so that we can even just nurture that connection or even be able to feel more safe. So when this is happening or is coming from home, then of course it complicates the matter. And one of the things I would say is that it's good that we acknowledge and ensure, or even you can call it validate the pain that one is experiencing, because I like to say that that's the only normal way that you can know that this person is behaving normally. When you're let down where you should actually receive support, then obviously it's okay for you to feel a certain way or negatively. So maybe the question is to ask yourself, what are those dynamics that are contributing to this? Is it what we talked about, the biological factors? Could there be maybe a history of depression in this family? Is there any genetic loading in terms of, could there be people within the family that could be suffering from certain kind of mental health conditions, so that then it's that reason that people in that family are suffering? So it's not like they could even be targeting you. Are there maybe pressure in terms of expectations, whether emotionally or even physically? Is there maybe conduct issues, you would say? And I agree that the first thing is to be fair to yourself, more compassion for yourself, and remember that you can't blame yourself for this. Then the other thing is to continuously maybe ask yourself, how do you strengthen maybe your own self by maybe even enhancing boundaries to some extent, and then also reminding yourself that you also have your own resources within everyone has resources within themselves that they can be able to call to this moment. And what you'd say, maybe some DIY, do it yourself kind of techniques, like you can incorporate like a breathing exercise, you can incorporate grounding exercise, maybe muscle relaxation exercise. And overall, what I would say is self-care. How the mind works, and this is based on a theory what we call the cognitive triad, is that whatever you allow into your mind will determine how you feel about the circumstance, and that again is what results into your actions. So if you're finding that there is, and this is a good model even when we are taking care of people who have depressive episodes, is that if you allow and you start blaming yourself for the challenges that you're going through, then obviously you're going to feel negatively about yourself, and most likely you're not going to act positively around yourself. So you feel good about yourself, so positive thinking again, and reminding yourself you're not the problem, and reminding yourself that maybe you're not necessarily the target, because you should be able to differentiate and ask yourself, are these people intentionally doing this, or are they also requiring support? And then when you do that, then you're going to find that, for me, I can practice some DIY. I can do a breathing exercise to make me feel better, so that I can work on myself. So for me, the end result should be on self-care. And self-care is ensuring that you're good physically, you're good psychologically, you're emotionally doing activities that are going to make you feel good about yourself. And then now you can balance these other areas of, including your professional, your spiritual, and even your social areas of your life. So I know home is definitely our first choice in terms when it comes to where we can be able to feel more comfortable emotionally, but not necessarily a place where we go to recover. But when this is the case, then we have to call on ourselves. And remember, mental health, in as much as organizations, as we keep saying here, the practitioners or the mental health professionals are going to support, it remains individual responsibility. So taking it up positively and seeking support, I think for me, whether you do it yourself through learning, psychoeducation, whether you do it through seeking care when you are at a certain level, then I think taking personal responsibility for me would work. That's how I would put it. Thank you.
All right. Thank you so much, John. Irene, do we have you back?
Yes, I'm here. I'm sorry. I think I'd reverted back to a listener. I don't know how I dropped.
It's
But I
okay.
can answer.
So,
Yeah. Yes.
okay. Yeah, so there's Gershon's question, and then I think probably just answer it together with Chebet Korid's question on who says, seeing as there are already several laws enacted concerning mental health, what more can be done from a legal perspective to ensure implementation of the same?
Yes. All right. Okay, so let me answer the first question, which I believe was about Section 76 of our OSH, which I think one of the speakers has also alluded to it. I think.
Irene, I think we've lost you again. Or is it just me? Can anyone else hear Irene?
No, we have lost him. Sorry.
Um, Oh, Irene, we've lost you again. Yeah, so please try connect again so we can answer both questions. Okay, yeah, we'll try and sort Irene in just a second. But yes, we have someone who has a mic. Please unmute. And keep your question as short and straight to the point, if you can. CPA Moemi, I think you have the mic. Kindly unmute. If you're speaking, then you are on mute. We can't hear you.
Thank you. I think Wanja has just responded to what I wanted to ask, so I'm okay with that.
Okay, great. Thank you so much. Irene, let's see if we have you back. If not, Wanja, who has the mic?
We do not have another mic request as of now, but on the comment section we have Muridi Karaoke, who is asking, how do we address the issue of loneliness, which is a risk factor to depression due to lack of social support system? Yeah, and then we also have, just a second. Yeah, on Dear Key, asking someone has been in depression and then they've recovered, but the effects have made them to be inactive and do not react. What are they then supposed to do in such a situation? I hope that's clear. If I see any other mic requests, I'll be adding audiences, but those are the two pending questions as of now, Winnie. Thank you.
All right. Thank you so much, Wanja. Irene, are you okay now?
We can try. Can you hear me?
Yes, we
Okay.
can. Yes, we
Okay.
can. Go ahead.
I'm so sorry. I don't know what happened, but my mic was on all the time. But it's techno stress, is it not?
No
Yeah.
problem.
Yes, technology can fail you when you least expect it. But I think the question, the last question is that what more can be done to enforce the law? Um, I think is picking up and just taking action from wherever shoes you're wearing or from whatever perspective you're wearing, whether you are, and I'm talking from my workplace here, whether you're the employee or the employer, and especially now from the employee's perspective and also employees' representative bodies, be it union or other, workplace representative bodies, speaking up either individually or collectively, in as far as employee rights are concerned, is important. And why do I say so? Is because under Section 76, as I said, it requires employers to, take all practical measures to protect employees from workplace conditions likely to cause mental strain. But I think, as we all know, in most of our workspaces, when we talk about OSH compliance, that is the occupational safety and health compliance, it's more on the physical aspect of safety. Even when risk assessments are done, they are not really done from, psychosocial or mental aspects. They're not really, they are more focused on the physical aspect. So I think I'm glad that we are now having a lot more conversations about this, and I think awareness is growing. And also, if you look at, like for example, Section 6 of the OSH Act, I'm just trying to paraphrase, but I think it says something like employers also have the duty to provide information, training, and supervision and instruction to employees to ensure that they attain safety and health at the workplace. So the law is already there. So I think it's calling upon those duty holders to actually, who are employers and or maybe leaders in the workplace, to ensure that like for example, when risk assessment is done, it's just not focused on the physical aspects of it, but it's also focused on the psychosocial and other aspects, to then comply with Section 76 that has to do with mental strain. And also policy framework. Most of our HR handbooks, manuals, and so on and so forth will have just a very brief aspect in as far as mental health is concerned. And even some policies will actually be silent. Yet, if you now purposively read and, construe and interpret Section 6, the one that I've just read, that employers are supposed to provide information, instruction, training, and supervision, that can be interpreted to actually mean employers are required to have policies in place, and those policies include those that ensure mental wellness at the workplace. Therefore, the second issue I've talked about, the first issue is risk assessment, the second issue is policy framework.
Winnie, I'm ready. Benjamin is ready. Sorry for interruption.
Okay, can I still be heard? I hope I'm still not talking to myself. Can I still be heard?
Yes, we can hear you. Sorry, I
No.
was just reporting
Okay.
my
So sorry. So yes. Sorry. Yes. And then so I've talked about policy framework, but let me also talk about but still on policy framework is just deliberate efforts being taken by employers about training, information sharing, and also disseminating these policies. Policies could just be there seated, in intranets or work drives or SharePoints, but are not disseminated to employees. So awareness sharing and policy dissemination to all those affected, but also support systems. I think my colleagues here are well versed and can talk about that. But employee assistance programs, I think, is peer support programs where maybe you're tied to. We had a conference recently from a law firm perspective, and I think one of the speakers was talking about having mechanisms in place where you're tied to, for example, to a mentor or to a peer, such that when you start maybe your behavior is changing, some action is taken that is not in a stigmatizing or victimizing perspective, but maybe just trying to find out is something going on that needs remedial measures from a wellness perspective, and so on and so forth. And if these now policies are there and they are being implemented from a non-stigmatizing and non-victimizing perspective, we will then be going towards compliance. But the truth is, as we speak right now, of course, there's a lot of fear of reprisal, stigma. But if employers now provide or ensure safe, confidential disclosure, and actually in their policies they embed requirements of requirements that actually ensure that there is non-retaliation when such things come to the fore, I think are some of the practical ways that can actually ensure there's compliance with what the law requires in Section 76 of the Occupational Safety and Health Act. And I think that answers also the last question that was asked: what can we do in as far as implementation are concerned? And of course, now regular monitoring and evaluation, but also regular surveys and audits, maybe even anonymous surveys would be important to actually just know what is the health status, what is the mental health status in an organization. Maybe I could stop there, Winnie. I saw someone wanted to take the mic. Thank you.
Oh, thank you. Thank you so much, Irene, for that. That was Benjamin joining us, Benjamin Zulu. We will come to you, Benjamin, in just a second. Dr. Crystal, can we have you answer the question on, this one says, where's that question? There's a question here about this is Gevira Mbaga who asked, how do you help someone who is depressed because they cannot afford to take care of themselves? Do you tell them to go for therapy or solve their mental condition? And then probably, John, you can merge these two questions because they speak on depression. Ondieki, who asked, someone has been in depression and then has recovered, but the effects have made the person to be inactive to reaction. What is he supposed to do? And please match that with the question, how do you help someone with low emotion? Oh no, that one was answered. What if the depression is coming from, no, I think we answered that one too. Wait, there are two questions, but hey, let's have Dr. Crystal and then John, sorry, I'll merge your two questions for you.
Yes, thank you for that question. So even just from the question, really, it points out to what depression is, because you have feelings of very, very low mood, sadness, lack of motivation to do anything. So that explains also how this person, is not able to take care of themselves. Sometimes you're not even able to get out of bed, to take a shower, to go get food, meet your needs for social interaction. And so the question is asking whether to get them to go to therapy. If you can, please do. But if that is out of your reach and out of the person's reach as well, then it really calls for what I think, was it John who spoke to it, just a bit of creativity and self-education to, first of all, understand that as much as you're coming in the role as a caregiver, you cannot really don't be harsh on yourself. Don't expect instant recovery or turnaround, and also understanding what depression is before you get into the thick of it, lest you also now start associating the failure with factors of your own that could be out of your control. And so for this person, depression, clinical depression, is actually a disease that comes from, imbalances in the brain. You're unable to experience joy, excitement, etc., like other people. And so your default state is just sadness and listlessness. Just to really paraphrase the technical terms. And it will be very challenging, I would admit, to manage depression as an untrained layman. But these days we have a lot of resources on hand. And something that you could leverage on, I know we spoke towards the cost of healthcare, but for assistance, we have several telemedicine platforms, and you find that their consultation charges, their treatment charges are much lower than your average hospital or office visits. And so that's an avenue you could explore. I know we have, was it John who's from HealthX? We have very many other platforms that are doing the same thing. I think there's like Zuri Health, this is a doctor. There are resources. If you just did a simple search that localizes it to, Kenya or to an area of your locality, you'd be able to find that. And on beyond that, there also are other resources or people that offer pro bono or free services in the way of support. So if you're religious, for example, if you go to church, your church might most probably has counselors or a wellness sort of institution in place. You can ask for that. If not, many of the big churches, if yours doesn't have, many of the big churches I know have something along those lines, and you might be able to get assistance for your friend or your family member. I can't speak for other religions, but I trust that there probably is something along the lines of that. We have many companies, not many, but we have companies that also have that as a CSR branch. And so a quick search that really asks for, free services, free psychosocial support could also help you as the caregiver, or whoever is as the person who's taking responsibility for your friend or family member, and for them as well. So those are options that you could explore and see how that goes for you. But because John is in the space, I'd like to throw this ball to him and see if there's something that I might have misspoken on, or if he can add to it. Thank you.
Thank you. Thank you so much, Dr. Crystal. And yes, John, on to you. And of course, the questions that were asked you're supposed to merge is, how do we address the issue of loneliness, which is a risk factor to depression due to lack of social support system? And please merge that with a question on someone has been in depression and then has recovered, but the effects have made the person to be inactive, to reaction. What is he supposed to do?
Thank you so much, Winnie. Again, if I could start where Dr. Christo had asked whether, yes, John is with the HealthX, yes, working with HealthX. Of course, it's a telemedicine company, and I agree with you that there's a lot that you can offer from that organization. And I'm saying this because I know we've talked about workplaces, we've talked about homes, we've talked about schools, and I know that the organization offers products around that area. But most importantly is that the issue of loneliness, the issue of depression, it's good to just note that loneliness is not synonymous to proximity in terms of how close you are to someone or others, but it's more about trying to ask ourselves, why are you feeling lonely? Is it someone who's going through an adjustment of a kind, like a transition? Remembering that all of us go through transition, be it when you're in school, you're moving from grade 9 now to the senior secondary school. Are you moving from high school into college? Is it from college into the workplace? Are you moving from the workplace into maybe family, marriages and all that? And all these adjustments, they cause different feelings, and partly could be feelings of loneliness. Is it that you're feeling that you're in a space but no one is noticing? And then are you feeling misunderstood? You're in a place but you're feeling you're out of place. It's also important to note that loneliness itself could be a symptom of a mental health disorder. So just being able to differentiate and identifying what's triggering this loneliness, it's very important so that you can be able to address. And in terms of again addressing this together with even depression, and especially where you're feeling that you've reached a place where you're even feeling numb, it's good to notice that the key important thing here is safety, is the need for how do you enhance your psychosocial support system. That means, of course, the number one support system is always family, but if it's lacking, what else can you do? And I remember, I think it's Irene Wakili who said, talked about even peer support system as part of the OSH requirement, or rather recommendation. So yes, peer support, friends, looking out for your friends. And one of the things I always recommend and working with my clients, and especially in this area, is that think about your workplace, and you have 2 or 3 colleagues within who you work with. It's always good to check at the end of the day or once in a while, even if it's once in a week. Just sit down and ask yourself, how are you feeling, how you're doing, how was the week, and how can we do better? And you'll always find that that person will feel that at least I belong someplace. I belong to this workplace, even if at home I have challenges. Then again, I also talked about your own taking responsibility of your own health. And I'll say when you reach that level of depression where you're starting to feel numb, it's like nothing matters anymore. Remember, this is where actually you're most likely to slide into depression. And so when you start to experience feelings of hopelessness, feelings of helplessness, it's good to notice, and don't take it lightly, but talk to someone who is close to you. It doesn't matter whether it's the guard next door or just someone. Just tell them how you're feeling, and whether it's the mama mboga out there or whoever, tell them how you're feeling, so that as you speak this, you can be able to get support. On your own, number one, as an individual, is first of all, don't judge yourself harshly, and then you can try what we talked about, the low-key, kind of connections, or taking small steps towards building connections. And one of the easiest ways is to try and reach out, even if it means to old friends. And an example I know is, if you try and reach out to people you knew a while ago and they are all over in your phone, just write to them and tell them hi. You'll find that out of 10, most likely only around 4 people will respond back and say hi, because most have already transited and moved on. But out of those 2, maybe 2 will want to keep in touch, and you have a connection. So those low-key moments, building new connections, just try to talk to people, And also remembering that you can also do some form of journaling. And because most people will always say that I don't like journaling, and especially people in the legal profession like Irenia, because they associate writing or journaling with too much writing, which is what they do a lot in their place. But an easy way is to think of how do you affirm yourself more, so that you stop feeling like you're out, like you're no longer important. Right. Remember that in any particular day, you could want to look back and ask yourself, are there 2 or 3 things that I'm grateful about? And you can write down that in simple ways, that I'm happy that I was able to join an X-Space, and we talked about mental health. And how did it make me feel? I felt good. And just write that. When you read that the following morning, then it reminds your brain is able to pick and remember that, I was successful. I was able to do something important yesterday. So it means I have hope and I can look forward to a better day today. So it's more about individual focus on self-care. It's more about focusing more on the little things that you can be able to do a step at a time. Thank you.
Thank you. Thank you so much, John. And we apologize. We've gone 12 minutes over the time, but just give us a few more minutes as we wind up. Benjamin, I'm going to give you the mic opportunity now to say hello. Salimia Wananchi. And we were supposed to co-moderate together, but I think there are 2 questions that I think you might also answer in the capacity of a counseling psychologist as well as a life coach. So there's one from Nick Didon who says, how do you fight the peer pressure in school? Maybe some people have better material than you and are better than you in terms of career. They post how they are achieving, yet I am not there. How can I handle that? And then there's also the question on, can you heal mental illnesses without medical intervention? Yeah, if you can answer that. And then there's another one. I don't know if these are too many
No, I
questions
can
for you to
just add it.
remember.
All right.
Good. Okay. And then this is from Dennis, who says, nowadays, environment contributes to mental distress out of anxiety amongst themselves. Anxiety to win big in jobs, simple lifestyle at home, which is readily inaccessible. In learning institutions, you'll need to not think about how things and situations are at home. I think this is more
Okay.
of a comment than a question, but yes, can we answer the
Yeah.
Q?
So, hey guys, and thank you so much for showing up. I'm so sorry I had a lot of technical issues. I was being able to be assisted by our team, our wonderful team here. And thank you, Winnie, for holding space. You really steered it very well. Now, to the questions on that student. And then the other one, whether you can get, without having to invest in real treatment, whether you can get relief from mental health issues. Now, how do you manage what your peers are doing and you're not doing? You don't have it as a student. I want to tell you that the one answer to all influence and shame and discomfort that comes from not being able to be cool, and display that you're also up to date. Not have the money, the clothes, the trappings, the new phone, or to be able to do the latest dance move, or a phone with a cool camera. Whatever it is that your friends are doing, and you're not able to match up to it, there's a discomfort there. But I tell you, the answer we have found psychologically is an answer you like to call standpoint. Standpoint is such a simpler word for perspective, where you look at that alienation or not belonging from. If you go to school and you're trying to build your life for the 10 years to come, so that after 10 years you'll be able to buy the iPhones, drive those good cars, wear those good things, the present discomfort of not being able to show off or answer when people brag about their boyfriend, girlfriend, or the trips they went to, or to respond with another post on Instagram. Whatever it is that you cannot match up the trend, and you're working for your life 5 years from now, you'll only smirk. That smile that says, I know something you don't. You'll only smile as if you know a secret. The answer to peer pressure is perspective. We are here to prepare. We are not here to display. that was my solution. I did not know the psychology of it those days, but today I know the psychology of it. Psychology of it is setting your mind on the larger goal. So I don't remember his name, but the question he asked about students, just change how you interpret your season in school. I have told Nick. So Nick, another thing is that you may not have a girlfriend, or they may not be turning you down because you don't have money, and your friends having girlfriends, or they're taking them out on weekends, and you're not able to do that. That's another source of mental stress: heartbreak, pain, distress, anxiety, rejection, low self-esteem, love relationships in colleges and campus. And I told them, if you go there to prepare that you may marry the best woman one day, the best one day. You come here to become the best provider and the best leader, and you are reading your book, you're spending your time in the library and with mentors and teachers. You'll appear odd, you'll appear old-fashioned or boring. You not appear, and that was my path. But I knew, let's compare notes after 10 years. Let's see whether I will have missed anything. And I can tell you 10 years have come and passed, and Nick, you can guess whether I regret anything. I knew if I prepare to be the best husband, I prepare to find the best woman and convince the best woman, I'll have the best chance. As opposed to indulging, getting injured, losing quality time, not spreading my wings to network, that kind of a thing. That's my answer to that. The other question about whether you can find solution to mental health problems without treatment. I want us to stop limiting mental health problems to illnesses, to mental illnesses. I want us to know that you can just be mentally fatigued. For example, you've been busy this week, now you're in a meeting, it's in the evening, you feel exhausted. So I want you to know that mental exhaustion is part of what we're talking about. You are not well that time. You need refreshment. So some of the lifestyle stressors on your mind, on your emotions, on your psyche, they don't need treatment, they need replenishment. You need to rest. You need to have an exercise. You need to have a person you can laugh with. You need comical relief. You need to sleep. You need to eat good food. Single people remember good food. Single people don't take good food. They take bread and cocoa. They just improvise whatever is nearby there. They just pass by mama chapati hapo na madondo. So they don't feed themselves. The food is sometimes not nutritious. When you are living alone and perhaps you are married, but particularly men, most of them don't like detailed cooking. They just want to go straight to the point, whatever does not tire them. And you can't take ugali sukuma the whole week and you expect to feel energetic. Some of your nutrients are missing. So you feel like you're tasteless. Your life is lacking excitement. So I'm just saying sometimes the cure you need is not a therapy session. It's a good meal. The cure you need is not a therapy session. It's not a pill. It's a calling a friend who lifts your spirit. The cure you need is to drive around and breathe with loud music, blasted music or whatever. Just to have a free spirit moment. Yes, you can have better mental health by replenishing yourself, having good circle that feeds you good information, doing window shopping, doing gym exercise, reading a good book, watching something, especially when it is part of tear and wear of your lifestyle. So yes, there is a place for medicine and therapy, but there's a place for having a lifestyle that replenishes you. Yes, Winnie.
Fantastic. Thank you so much, Zulu, for
Most
that,
welcome.
for those answers. And I wonder whether there are single people here who do the cocoa and and bread, please, nutritious food. And also there was someone who asked, is there a recommended type of food for a depressed person? I think maybe John, you can answer this as part of your parting shot as well. Yes, but thank you so much to everyone who's tuned in and also patient enough up until this far. Let's give our panelists, including James and Betty, 45 seconds to a minute ya ukweli, not ile Kenya, to just give your final remarks on the conversation, even as we prepare for a bigger conversation, and that is a conference that will be held next week on Tuesday, that is the 30th of September at MRS Sereni. But for now, John, can we start with you on the recommended type of food for a depressed person, but also just your final thoughts on the conversation tonight?
Okay. Thank you so much, Winnie, and it's been a great conversation. I would say that I'm not very good at that, and the reason it's good to own up and say that we work collaboratively with other professionals We have nutritionists who can be able to guide us on that. I guess as Benjamin has said, yes, there could be that place. And just to add on to that is to say that, yes, we have to work collaboratively with other professionals. We could reach a point where we feel when it's a condition, then we might need to consult a psychiatrist. We might need to consult a neurologist because maybe of the kind of condition it is. But having said that, of course, what I would say is it's important to eat a healthy meal so that we can be able to become better. For me, I think just to say that emotional support, of course, or even the support that we're talking about on mental health is not a luxury. It's more of a foundation, and everyone is going through an experience. So when we are here, we are educating each other, we are supporting each other, transition, and even making sure that we become better. So just to encourage all of us to invest more on ourselves, to invest more on seeking support, and so that we can overall protect our mental health. Otherwise, I want to thank you so much even for this opportunity. And of course, I ask you, take responsibility of your own mental health. Thank you and a good evening.
Very well said. Thank you so much, John. Dr. Crystal, and also speak on, are there packages, say like family packages, or even for the learners in school? Are there packages as well for them when it comes to insurance cover, especially for mental health?
Thank you. So I'll start with the last part, the last question first. So yes, and I say yes, a prolonged yes, because it's, for example, it depends on the approach to it. But for learners, for example, for families, a lot of insurance packages now come with, apart from just the regular outpatient, inpatient support for mental health, some of the employee assistance programs that people have alluded to on here have, okay, let me not be general. For example, at Minet, if you have access to the employee assistance program, you have 24-hour, 7 days a week supported line that is manned by counselors. Anybody that is in the cover, be it the principal, the spouse, the children, can access free mental health counseling, crisis intervention at no additional cost and at no deduction from their insurance. That's just one of the packages that we offer, and I would imagine that a few other underwriters might have something along those lines. So some of these packages exist. Others are still in pilot, like school-based mental health programs that support students, teachers, parents, the communities. I know Ampath in Eldoret was working on something along those lines. And so it's a growing space, but it's something that we're starting to see a lot more of. And we are happy that that is taking shape in the country, and hopefully we will have better access to mental health services. That being said, I will say that my parting shot is just, it's a cliche phrase, but surely there's no health without mental health. And I urge everybody that has been here to at least take one day in a week, 15 minutes, 30 minutes, just sit, no music, no phone, no book, just sit and think about yourself, find something to be happy about, cultivate culture within yourself of appreciation, of gratitude, and trying to identify if something is going wrong, if something is going right, and intervening before it goes to the extremes. Thank you very much, and thank you all for your time.
Thank you. Thank you so much, Dr. Crystal. Irene would also take your passing shot, and especially when it comes to family, probably speak a little bit on how the law then protects, especially for children, when it comes to mental health and when it becomes a concern, especially when mental health becomes a concern in a family setup. And then we'll take your passing shot.
Yes, thanks, Winnie. So, yes, mental, I think one of the speakers earlier on said, yes, the family setup is presumed to be a place where you find safety, but unfortunately, that could also be a place that, makes it even worse. So, what does the law then says? I think I would want to refer to the Mental Health Act. One of the rights that is set out there is a right of a person who is suffering from mental health to receive support from family. Actually, family is expressly set out. I'm just trying to paraphrase what the act says, but family actually is expressly set out as one of the stakeholders that should provide support. And I think the question I asked myself when I saw that is that how do you even enforce that? So of course, there are many questions that are pending as far as enforcement and implementation is concerned, as one of the listeners asked. But the law is there. The law is there that provides at least a baseline to answer some of these questions. But implementation is far from where we should be. But I'm glad we are at a better place than we were, some few years ago. And these conversations are happening. There's some guidance from case law, from guidance from international organization, WHO, ILO, and such kind of organizations that are giving good guidance. And as far as mental health is concerned, and I'm sure as we go along, implementation will get much, much better, and some of the things will get clearer. And I think the other thing that is really happening, the other dynamic that is really happening, is that there's much more voices that are being raised, especially from the younger generations. I think the older generations, because of stigma and maybe discrimination or victimization, the issue of being very vocal about mental health, even from the workplace perspective especially, was not as much as we can see right now. So I think that space is very, very welcome. But one of the things, it's only that we didn't have a lot of time to talk about, but one of the things that I planned to talk about and maybe even actually pose as a question, and maybe this is a question I may not necessarily answer right now, but pose it, and those of us who will appear next week during the conference, we can maybe engage a little more. I've seen from my practice, employers actually ask a question, a very fundamental question in my view, is that yes, we want to take care of mental wellness and employee assistance programs at the workplace, but we are seeing cases where we are suspecting that issues of mental health are being abused, such that an employee is not showing up on Monday or Friday, and when they're asked, they actually say, I'm not in a good mental space, or they are being taken on a PIP. As soon as a PIP starts, they say, I do not want to, I'm not in a good space, or a show cause letter or a disciplinary hearing. So I don't know whether my colleagues here have faced such a thing, but maybe we can discuss that a little further next week. But I think maybe the take home for me is that we should not. These are very serious issues, matter of life and death, and it's upon all of us to ensure that we, address these issues meaningfully and not maybe in an abusive manner, in the manner in which I've just talked about, but so that there's accountability from all stakeholders, whether you're an employee, whether you're an employer, whether at the at the home front, and everyone, government perspective, and so on and so forth, so that everyone who's involved is accountable, so that we deal with this issue, which can really be a matter of life and death. Thank you so much, Winnie.
And thank you so much, Irene. Indeed, something to look forward to, and even a greater conversation on 30th. All right. So we'll have Ben and Betty as well as health advocates, and having gone through it and found help, sought help, and found help, and you're advocating now. What will be your part in short, not just on today's conversation, but even in, let's say, a few months to come, a few years to come? What sort of conversations would you like to either hear or to have had as far as mental health is concerned? We'll start with you, Betty, in like a minute, so that we finish by the top of the hour.
Thank you so much for this space. I think what I'd like to say is just, we should all play our part, to end stigma, and to just, a little, a good word, a helping hand will just go a long way to just ensuring that the person next to you is well mentally. What I'd like to hear, in a few years to come is that, the stigma, stigma has ended in so many spaces, at work, at home, and schools, and to just accept the people as they are, and to just offer a helping hand. And also in places like this, I like to see more formerly imprisoned women just coming in here to just say that because of such spaces, they're able to just integrate back into the society well and just, continue with life, where they left off. So thank you so much.
Thank you, Bethan. We really appreciate it. Great, point over there. All right, James.
All right, thank you, Winnie, for the opportunity again. And what I love to say is let's normalize mental health conversation within our spaces. And our spaces starts from home, schools, like peer groups, worship places. Let's just try to normalize the mental health conversation each and every day, because mental health is a shared responsibility. And looking ahead, my parting shot is just to someone who is currently struggling in silence. Just know that silence feels safe, but it is heavy. You don't have to carry it alone. Start small by just talking to trusted person, journaling your thoughts, and even seeking a peer support within your surroundings. Because healing is not instant, but every step you take toward sharing your story, sharing your burden, lightens the weight, because you are not broken. You are just human being. So feel free to be vulnerable, have freedom to express, to connect, and through connecting, you'll get the necessary support that you need. And I do encourage people to also embrace storytelling as a healing tool, because through that we connect, and through connecting, we can find something that someone has used in terms of coping mechanism with their mental health. And looking forward to such kind of spaces to continue to contribute meaningfully to mental health conversation. Thank you.
Thank you so much, James, and thank you to both of you for really, coming by today and really painting the picture when it comes to mental health and putting a human face to it. So we say thank you. That was James Nyabera, mental health advocate and founder of A Man Must Cry mental health movement. We also had Betty Kagu here, who's a businesswoman, a mental health advocate, and an alumni of Clean Start Africa's Ufunuo program. John Kimura, clinical psychologist from Health X Africa. Irene Kashindi, who's a partner and head of employment and labor relations practice group, Munyao Mutamba and Kashindi Advocates, and Dr. Crystal Vulavu, who's a head of wellness at Minet Kenya. Thank you so much, our panelists today, and thank you so much for our listeners as well for sticking with us until this far. And just a reminder that the conversation today started even a bigger conversation on a conference that we'll be having on the 30th of September from 8 to 5 p.m. at Emara Ole Sereni. The tickets go for 9,500 shillings, but for more
I bet we lost Winnie. Zulu, you can take it over and just close. Thank you.
All right. Thank you. So, guys, as my colleague was saying, we are very grateful that you made time and you stuck with us. I'll close with this story where one of our former presidents, Daniel Moi, went to a mental hospital to take just a courtesy call. Then he was talking to some of the patients there, and he was asking them, what's your name and all that. So one of the guys there, when he asked him, hey, my friend, what's your name? He returned the question back to the president. You, what is your name? And the guy told him, I am Daniel Moi. I am the president of Kenya. And the guy looked at him suspiciously, said, my friend, before my grandmother died, she also started calling herself president. you know. Just that story to highlight. Sometimes the people who have problems don't know they have problems. They think it's the others who have problems. I don't want you to live here with a self-righteous attitude. Say, those guys, if I meet them having depression, I'll help them. Sometimes you don't realize it. You're pointing fingers at others, and you yourself, you're overwhelmed. You're exhausted. You feel lonely, feel rejected, but you're trying to be strong. My encouragement is, we are meeting on Tuesday next week, 30th, as my friend has reminded us, my colleague has reminded us. We're meeting on Tuesday for that mental wellness. But I don't want you to point fingers at others. You guys, I'm helping you deal with your mental health. Look at yourself. Are you stressed? Are you anxious? Are you aligned with your career? Are you at peace in your life? Do you have a happiness? When lastly did you laugh until your ribs ached? Ama maisha yako imekuwa kauka ngumu gangster? That is also mental health problems. Where is your joy? Have you lost your energy for life? Those kind of things are what we call about wellness now. Wellness. I want you to look at your life and bring back energy, bring back joy. Sometimes you have outgrown your career, but because it is what is paying your bills, you're stuck there and you have lost your joy. I just want to ask us, don't wait. Usifananishe mental health na kuguruka. Usifananishe mental health na psychosis, na schizophrenia. Fananisha mental wellness na happiness, na peace, na joy. Please go well and look at yourself. And see you guys next week at Emara or Sereni on Tuesday. Please come, we meet there. We have more and more. And have a good evening.